The greatest cause of death in burns is due to smoke inhalation and asphyxia. If one throws a Burnshield blanket over oneself and a child or something like that, you are first of all entrapping cool air inside that microenvironment. It's going to give you the ability to run through the fire and get out. So in terms of doing that, it's life-saving. There's nothing at the moment anywhere in the world that does that except a fireman on the outside trying to come and fetch you.
Dr. Kramer, your opinion of Burnshield?
The treatment of burns has always been, in heat burns, to cool the burn down. And in the emergency setting, because there's been nothing available in a medical point of view, people have just been told, put on water and cool it down, and keep on cooling it down. Burnshield gives us the ability to use a solidified form of water, put it on the burn, and that's all you need to do, because then the Burnshield actually keeps on drawing out the heat. So it's a substance which I hope is going to revolutionize what people can actually do in their homes and wherever they're going to be burnt.
Which features of Burnshield do you consider important from the patient's point of view?
We need to cool a burn down. We need to keep it cooled. We need to protect it from whatever is inside the dressing from getting out, such as fluids. We don't want the patient to dehydrate because you've lost a protection to the skin. And you want to prevent it, anything that is on the outside that shouldn't be getting in, so such as bacteria. Now, Burnshield, particularly in the way that it has its dressings, does that. It cools the burn down. It prevents any fluid being lost from the body. It prevents any bacteria getting into the body. And that's probably the most important features of any emergency treatment of a burn.
Where should Burnshield be used?
The greatest majority of burns are in the home. So as every home should have a fire extinguisher, as every picnic should have these kind of features, so there should be Burnshield as well. Burns happen in the kitchen, so it should be in the kitchen. Burns are going to happen at a braflas, it should be at a braflas. They should be at camping areas. They should be anywhere where somebody gets burnt. And unfortunately, that happens every day all over the country.
My mother used to use butter for my burns. Is that absolutely out now?
Butters and lotions and potions have a problem in that, first of all, they can contain the environment and make the actual burn worse. Second of all, when you then get to the hospital and you want to treat the patient, you don't know what's going on. You cannot decide on the depth of the burn because you've got butter all over the place. Now you have to remove the butter to get medication on. And it becomes now a very painful process and a very difficult process to now remove the butter and the margarine and the oil so you can get to them.